Idaho healthcare leaders are warning the public we are in the fifth COVID surge. The state has a backlog of nearly 15,000 COVID tests. Health and Welfare says this is one of the fastest surges that they have yet to see. Andrew Bartline has been covering the media briefing with Health and Welfare for us today. Andrew, how is Health and Welfare treating the state's high numbers with so many tests still waiting to be processed?
Well, they're looking at the percent positivity, Katya, knowing how many tests are waiting to be processed and knowing roughly what percentage of tests in general are coming back positive. The state's able to map out an idea of where we're at. The percent of positive COVID tests has doubled in the last month from 8.6% in December to 17.1% in January. For context, Health and Welfare says the Delta wave peaked at 17.3%.
We expect that to continue to increase.
Recent state sequence data says Omicron accounts for 88% of infections.
So that would lead me to believe that it's probably going to replace Delta, much in the same way that Delta came in and replaced Alpha at the beginning of the summer.
Health and Welfare's website says the sudden rush for testing demands has backlogged nearly 15,000 tests, leading to inaccurate reports about the current state of COVID in Idaho.
With about 3,000 positive results that Idaho public health districts are having to manage every day, it is exceedingly difficult to turn those investigations around within 24 hours.
But after applying the percent positivity rate to the nearly 15,000 backlogged tests, Health and Welfare predicts Idaho's case rate is closer to the orange line, while the blue line is what's currently published.
This would represent one of the highest 7-day average incidence rates we have seen over the course of the pandemic.
Health and Welfare has used the percent positivity as a tool to predict what's ahead for the healthcare system in the next couple weeks. And this Omicron wave has Health and Welfare concerned for our Idaho hospitals.
Healthcare systems are under a tremendous amount of stress right now, and we expect that to get worse before it gets better.
The concern with hospitals in Omicron is that it's very contagious, and while it might be more mild in nature, an abnormally high number of people may still need to be hospitalized. And if healthcare workers get sick themselves, they can't treat their patients. So that's a big concern with Health and Welfare for the coming weeks, Katya.
Yeah, absolutely. Continuing to break records. It's just shattering. Thank you, Andrew.